Well, welcome back. You know, all week we've been addressing women's health topics in accordance with National Women's Health Week. And during these uncertain times, pregnancy can understandably cause some increased concerns for mom-to-be.
Of course. Today, Dr. Lyabode Ogunlade, OBGYN at Memorial Hermann, Cypress, is providing insight into questions about COVID-19 and the implications for women who are currently pregnant. Dr. Ogunlade, welcome to the show. And first of all, let's just jump right into how COVID-19 can potentially affect pregnancies. And I know we've chatted about this on the show before, but there seems to be new information all the time and still a lot of question marks remain.
Yes, that is absolutely correct. There's a lot of questions. There's a lot we do not know about COVID-19. But what we do know is that pregnant women they're slightly higher risk, but it's not to the proportion of the anxiety that is publicly felt. If they follow the same CDC recommendations as the rest of the general population, they tend to do very well, mainly hand washing, social distancing, and there have been some reported cases of newborns that had COVID, within a few days of post-birth. But generally, we don't think it's transmitted in pregnancy. We just don't have enough robust data to support that evidence one way or the other. But we do know that it's probably transmitted postpartum. So at Memorial right now, we screen all of our pregnant ladies. Everybody gets screened. If a mom is positive, we unfortunately have to separate mom and baby right after birth until mom has tested negative or gone through the suggested time period to be separated. But they can still breastfeed. They just have to wash their hands and clean the exterior of the express milk container.
What I think is so interesting, Dr. Ogunlade, is that when we're talking about COVID-19 in general for pregnant women, the takeaway here, what I'm hearing from you, is they're not any more susceptible to this than any of us, right? I mean, as long as they need to take, obviously, the same precautions, wearing the mask, being cleanly, but the susceptibility is not there for them.
We don't have the evidence one way or the other. We do know that pregnancy generally can make you more susceptible to infections. But we don't think it's necessarily, for instance, 10 times that of the general population or 1 million times that of the general population. That generally, pregnant women can still keep themselves and their babies safe by following the same recommendations as that of the general population.
So for pregnant folks who are out there watching this program right now, what should they be doing? Obviously, prenatal care is a big deal. If they have questions about coming into a medical facility, I'm assuming the first step is reach out to your doctor and ask. I mean, are there prenatal appointments they can televisit?
To actually call your doctor and ask first. You don't want to just pop in the emergency room because you might actually be exposing yourself unnecessarily. So talk to your physician. They'll ask you your symptoms, and they'll be able to tell you if your symptoms can be managed, at home, or if you need to come into the emergency room. Obviously, if somebody's having respiratory failure, they can't breathe, they look blue, they should go, you should call 911. But if you're unsure and you're still talking and you feel comfortable, you don't have a fever, it's best you stay home and talk to your doctor first before you go into the ER.
And I think you kind of hit on this too, Dr. O, is a little bit when we talk about after the baby is born, and if the mom is able to breastfeed and wants to try that, there shouldn't be any reservations given the pandemic that we're dealing with. Breastfeeding can still happen during this time.
Yes, we think so. It just might have to be expressed milk if mom is positive, for instance. So mom would have to be separated from the newborn and would have to possibly use a breast pump to express milk that can then be given to the baby.
And doctor, I just want to chat about Memorial Hermann Health System briefly. I'm seeing in my notes here, I think people forget just how extensive the system is. Largest not-for-profit health system in Southeast Texas, 17 hospitals, 8 cancer centers, 3 heart and vascular institutes, 27 sports medicine and rehab centers. So when it comes to something like a pregnancy or a medical condition, really of any kind, patients really should be going to the best of the best to ensure they're getting proper care.
Memorial has been honestly amazing since the COVID pandemic hit. We've been testing all our patients, because, ACOG had that data that potentially 1 out of 8 pregnant women could be COVID positive. They got us N95 and PPEs right away. Our patients have felt very safe there. And patients that are positive are kept in a negative pressure room with experienced nurses taking care of them and their baby. And we try to minimize transmission. So, yes, Memorial has been really, really good.
And the good news is we can all have our babies. It's all going to work out. They will be healthy. And
yeah, you don't have to be afraid to come to the hospital to have your baby. Of course, we're limiting visitors, unfortunately, for everybody's safety. But your partner can still be with you. You can have one family member with you.
Yeah, well, safety comes first. Dr. Lyabode Ogunlade, thank you so much for your time today. We do appreciate it. And in the meantime, to our viewers, if you would like more information, you can visit memorialhermann.org/women's, or you can call 281-206-4496.